most surgeons who operate on the nose are blind. So let's talk about that. Most surgeons who do rhinoplasty cannot see what they're doing, and they are effectively somewhat blind. This was the way I was taught. This is when you look at rhinoplasty online, how almost every procedure is being performed. So what does it mean to be blind? Well, being blind means you cannot see what you're doing. And for most surgeons, when they're going underneath the skin, when they're making physical changes to the bone, they're doing this underneath the skin, and they are guessing where the tip of the chisel is. While they're doing that, the chisel may be in the bone, it may be below it, may be cracking the bone, making some sort of line, but they're doing this without the benefit of sight. The bone may be thicker on one side, there may be edges all along the bone, but they're doing this all again, quote unquote, blind. So why do I not like that? The biggest issue I have with that, again, is when you're doing something blind, obviously you cannot see what you're doing. And in this case, you cannot feel what you're doing because you're feeling through the skin, through the muscle of the bone, and over the periosteum. I prefer to open up this whole area and see this. It's the same incision that you would normally do, but you have to undermine the skin over the bones. And when you're doing an osteotomy this way, you have direct visualization of what you're doing. Oftentimes when I do that, you'll see little edges of nasal fractures. You'll see that one bone is slightly thicker on one side than the other. You'll see that maybe a bone is a little further out one way or the other. And what you're doing, or at least what I'm doing on this, is I'm contouring the bones to make them as smooth as possible. It isn't physically impossible to make someone's nose perfectly straight, but you have a way better chance of doing this when you're seeing what you're doing versus when you're guessing what you're doing. So I'm not a big fan of doing things blind. I think you should try to have as much direct visualization of what you're doing. And that way, again, you're going to have a way better chance of getting more successful outcomes in rhinoplasty.